Hi, health is wealth. Have you thought about physiotherapy? What comes to your mind when you think about physiotherapy? With me here in the studio, I have Joey, who is a physiotherapist. Welcome, Joey.
Thank you
Nice
so much.
having you.
Absolutely.
I love the fact that you're here today on your outfit, looking all professional and everything. It's really nice.
Thank you.
So I want us to talk about physiotherapy. A lot of people, when they think about physiotherapy, they kind of think it's a lady's job.
Okay.
Honestly, I've heard some people when you think about physiotherapy, I think they don't know what physiotherapy is all about. They just feel, oh, that's a massage. That should be a lady doing a massage. Some people, when they think about physiotherapy, what comes to their mind first is massage. And then they are like, no, massage is just for ladies. Some people don't even feel comfortable, like putting down their bodies and then someone else is giving them a massage. So I want you to tell us about it. You're working in Nigeria, a very cultured society. So I want you to talk to me about physiotherapy.
All right. So basically, I think the view of the world is changing. We are getting to a point where wellness is selling more. People are depressed, and sometimes are hard. You get people are looking for a way out, and they are looking away from the norms. So you're looking at getting holistic wellness from your body. You understand? Mental wellness. Everything just all wrapped up in wellness. So physiotherapy coming into play here, it's not really a gender-based profession.
In Nigeria?
Everywhere.
Oh, okay.
Everywhere. I think it should be more of a male thing.
Okay.
Yeah, because there is a physical therapy. That is physiotherapy, physical therapy, right? You're mainly looking at using your strengths. So there are some perks to it. For instance, if you have a very slim person, there are certain kind of people they cannot work on.
Really?
Yes.
Is that part of the ethics of the job?
It's not part of the ethics, but I mean, no three people have the same body weights and size, right? So if you are a bulky kind of person, as a physiotherapist, if you're a bulky kind of person, you are more on the advantage of meeting to everybody's needs compared to someone that is maybe a lot slimmer than I am.
But you're fit, but you're a slim person, but you're fit.
I'm a very strong person.
Oh,
I think
okay.
the heaviest,
That's nice.
the heaviest weight I've lifted, because I lift my clients a lot. It should be 135 kg. I weigh 73 kg.
Wait.
So that's yes.
Do you mean you have to like carry people?
Yes.
Like lift them off the floor?
Yeah, like lift them off the bed when they're lying down off the bed. It also comes as a shock to them because they're like, how are you able to? But it's all in the technique.
Wow, you're stronger than you look then.
Of course I am.
Oh, okay.
I'm a Nigerian also. Yeah.
Okay.
So basically, it's not gender based. You understand? Depending on what you're doing. If it's for the massage side, there are so many types of massages.
So, but there's something I want to know.
Yes.
Is physiotherapy? I thought physiotherapy, you're just supposed to work with probably people with broken bones or people out of the hospital trying to get back on their feet, and then being a masseuse is different.
It's broad.
Oh, okay.
Being a massage therapist is a branch of physical therapy. Physical therapy means you are physically involved with the person, you understand?
Okay.
So helping the person to heal or to recover physically, you understand? So massage is a branch of physical therapy.
Okay.
Exactly.
Okay.
So in my own case, I'm doing both.
Oh, okay.
I'm doing both, you understand? So I have a...
Sorry to say, why are you doing both? Are you doing both because of the money, or you're doing both because of the love of the job, or you're doing both because of the love of the people?
So it's everything.
Okay.
Of course, the money is always going to be there. Okay. That's how I see it. So what I give is quality. All right. So I'm doing both because it's the demand. You know, there are people that they first for you to even allow someone be in your space and you have to lie naked in front of that person. You need to be, yes, of course.
Wait, do you have to lie naked?
Absolutely, you have to.
Wait, so as a woman, I lay on the bed, naked as in pants and bra naked, or stark naked?
To answer the question correctly, you should be stark naked. You'll be covered with a towel.
Ew, that's disgusting.
But that's the work. If you're going in for surgery, of course, you know.
But this is not surgery.
It's the same thing. It's the same thing. It's just bloodless medicine. That's how I see it. It's the same thing.
And you feel really comfortable doing that?
It comes with the job. It's like telling a doctor, or someone that works in a mortuary about a dead body. They've seen so many. So it's like the same thing, you understand? So like telling a doctor about a blood, you understand, is so for me it is, I'm seeing you sitting down, all I've been checking out is, oh, you are not sitting right, this is not aligned.
Yeah,
this
I'm not sitting right. I'm not supposed to be
exactly,
seated like this, in my back like this.
exactly.
And all of that. But
So,
okay.
so that is what I see. So the moment the person is coming in fact, I have clients. Let me give you this little secret. I have clients that come in and they're like, "Oh, you know, I have this pain. That place I had the tattoo." I'm like, "You have a tattoo? They're like, you didn't see it? No, I'm not paying attention to you. I actually cannot even see you."
So you're trying to say a full-grown man is laying down on your massage bed, or what do you guys call it?
Yeah, the massage bed.
Bed. Naked with all the nice shape and everything, and you're not seeing all of that.
No,
I don't know why I don't believe you.
Yeah, absolutely. So as at today, I've done 384 sessions for this year.
Okay.
384, and of course in a year you have 365 days. So I'm way ahead, meaning an average of more than one session per day. You know, trust me, it's there is a point you will get to. It even has a negative toll on us.
Really?
Yes, because there's a point you get to, you would almost not have feelings. Yeah, you see your partner naked and you don't react.
Really?
Yes, and I've had a lot of massage therapists even complain about this. You see someone naked, it's just work. You're looking at the person like, okay, you're naked and this is like human anatomy, that is the end. You're not having feelings. So it has a negative toll on us. I remember, I think sometime last year, I suffered that a lot.
Okay, could you tell us that what happened?
Yeah, of course, for like 3 weeks, and that is the first time in my life I've had to take any kind of herbal mixture for this. Yeah, my body wasn't reacting, and I was like, I'm too young. What? So I want to. In fact, I even went to a strip club, and when I say zero, nothing, I was looking at them like, nah, this person, no, this person. So I was like, this person might have this disease. That was what was just playing in my head. I was not feeling anything, so I had to see a psychologist. Like, okay, what? I'm like, I can't feel.
Okay.
I can't feel. So of course I had a girlfriend then, God bless her, so she's dead now, you understand?
Oh.
And so then it was a huge problem. She's like, oh, are you seeing someone else? I'm not seeing someone else. The thing is, I want to feel for you. I feel every other thing, but my body cannot just respond.
I think for something like that, then you'd be very good for celibacy then. Or I mean, for relationships that want to go like into celibacy, I think that your kind of person will be the best boyfriend for that, because I mean, you're not going to want to have sex, so which is good.
But it's not healthy.
Having sex is not healthy.
Yeah, not having sex is not healthy.
When married or unmarried?
As far as you say having sex, not having sex is not healthy. How? For a lot of reasons. Okay, so when you have sex, a good sex, by the way, you understand? So there are some chemicals that are released in the body. Two of these chemicals are actually oxytocin and serotonin. So there are levels to stress and there are stressors, right? So there's a kind of stress you go through in a day. You want to come back home. You want to actually meet someone you call your lover. You understand? You want to.
Is that why?
Oh. No, it's not because of anything. You understand? You want to share, even it could be your brother or something.
Okay.
You understand? You want to share your day with that person. You understand? So there's a kind of relief. Even if the person doesn't do anything for you, they just listen to you and say, There's a kind of relief it brings to you. You get that kind of relief also you get from sex. You understand? There's a level of stress you accumulate where if you don't have sex, provided you've started having sex, if you don't have sex, you can really misbehave. You have a extreme burst of anger. You have your irritation level will be very high.
Oh yeah, I hear that all the time. Like when you're watching like American movies, you always hear that. Especially to women, they'll be like, "Oh, you need to have sex so you can calm down."
Yeah, so
they'll be like, she's a bitter old woman. She needs to have sex so she can calm down. Exactly. I hear things like that.
Yeah, but it's real.
Okay, cool.
It's real, yeah.
Okay, so let's take it back to physiotherapy now.
Yes.
I want you to talk about the hazards of your job. Because I know as much as there are pros, there are also cons.
Exactly.
So I want you to share more, like probably on experiences you've had, which you are like, oh my God, I know they do this job again. This job is annoying, things like that. So yeah.
All right. So I've been on this now. This December makes it 9 years.
Wow.
On the field, and it's a lot. So many. Of course, there are cases of attempted rape.
In what way? They wanted to rape you, or they claimed you wanted to rape them?
No. The other way, they wanted to rape me. Females and males. Yes. In fact,
That brings us back to talking about LGBT, gay and stuff. That's going to be our next topic. But let's leave this one for now.
Yeah.
Okay.
So, I mean, the most recent one was actually a male client. This was, when was this? This was in September, ending of September.
Do you think some of them just actually, they don't want physiotherapy, but they just actually pay just so they can have an advantage?
Yes, and I've been getting, because it's opened my mind to that, so I became more observant.
Okay.
So when they are making their requests, you are asking them questions like, do you have body pains? Do you react to balm? You understand? Do you react to this kind of oil? Those are normal professional questions.
Yes.
They don't care about that. They're like, no, just come. You understand? So before I'll be like,
just
okay.
come. Do you go to their houses sometimes?
When you're doing a home service. So this happens when you're doing a home service. But of course, I've had a spa experience where I practically had to beg for this man to let me go.
That's so
told me,
embarrassing.
for months he's been coming. Every 2 weeks he's been coming to the spa, getting his sessions, and he's always tipping me. You understand? Because of him, I had to like step up my game so that he doesn't get the same kind of service twice.
Can you shed more light on the game you stepped up?
No. Like I started reading more. You understand?
Okay,
I upgraded myself here. So he told me, yeah, for real. He told me, I've been coming here from the beginning of the year till now because I find it very attractive. And I looked at him and I said, oh, I appreciate that, sir. But you see, I am not gay. So thank you for the compliment. And he's like, okay, he had some more stuff up his sleeves. So while in the session, he grabbed me by the tie